and in particular, of course, of concern are the narcotic drugs, which account for a great many overdose deaths. And the use of narcotics has been declining in the last few years and continued this year. And the overall use of prescription drugs in general is in decline. So I think those are important developments.
Rejoined by Miranda Kahn, J.D. Hayworth back with you on America's Forum. We heard right there from Dr. Lloyd Johnson, the principal investigator at the National Institute on Drug Abuse, taking a look at the numbers for such abuse in the year 2014.
Yeah, despite these declining numbers nationally, this is just a horrific statistic to think about. Nationally, 1 in 5 high school students abuse prescription drugs.
Now the state of Ohio is trying to get ahead of this by requiring schools to teach their students about the dangers of prescription painkillers, one many scientists link to future heroin abuse.
A new law signed by Governor John Kasich last month will require the state education department to have recommended lessons in place by July 1st.
So will this program set a precedent that other states might follow? Joining us now, Michael Barnes, Executive Director of the Center for Lawful Access and Abuse Deterrence, the acronym CLAD. And Michael, it's good to see you clad there in your blazers. You join us from Newsmax, Washington. Let's talk about this. Do you expect other states to follow Ohio's lead?
Yes, I do expect that other states will follow Ohio's lead because Ohio has been one of the leaders around the nation in dealing with prescription drug abuse very aggressively. And this type of effort of providing education to students about the risks of medication abuse is something that my organization has been calling for quite some time. So Ohio is at the lead of implementing the recommendations for how best to deal with prescription drug abuse.
We say you've been doing this for quite some time, or trying to. Why isn't prescription drug abuse already taught in health classes?
I think that at this point we're just reaching the time when the news media and the public in general is starting to understand the issue of prescription drug abuse. And we still have a ways to go because, as you noted, we're still talking about prescription pain relievers, but really the issue is broader than that. It also includes benzodiazepines like anxiety medications and stimulants. That's another big problem. So we're hoping that Ohio will deal with those medications also when providing education about the need to be safe in using medications and avoiding any sort of substance of abuse, of course.
And as we were bringing you on, Michael, we heard from Dr. Lloyd Johnston, who said some of the numbers were declining for the calendar year 2014, but as we understand it, just under 20% of high school seniors, 19%, said they had abused prescription drugs in the last year. What should we glean from that statistic?
I think we've got an issue that is cultural in nature, and so we really need to focus on education and changing the culture so that people realize that medications, although they are prescribed by licensed professionals, they are potentially deadly if they are not used properly. So that's the first piece, is we need to make sure that people understand that these are not all benign substances if they're not used properly. But then also we've got to deal with prescriber education so that the people who are actually prescribing these medications know the risks and prescribe appropriately, of course, but also know how to identify when there's a problem and refer people to treatment. So this is a big issue, of course, and my organization has a comprehensive national strategy because it's going to require solutions from multiple sectors of society.
Right, and let's be honest here, Michael. Where are these teenagers getting these prescription drugs? From their parents, right?
Well, not exactly, because a federal statistic shows that about 20% of the people, maybe even up to 25% of the people who consistently abuse prescription medications are able still to get them from licensed professionals. And so there is, of course, the need for family members to lock their medications or secure them in a way that works for them, of course. But there's also, as I mentioned, the need to ensure that the prescribers of these medications are taking the adequate precautions and then following up to make sure there's not a problem. So it's, of course you want to lock your meds, but we also want to make sure that the gatekeepers in our stream of commerce are making sure that only the right people get these medications and not those who would abuse them.
Michael, let's want to bring your attention now to a study from the University of Michigan, and they break down some of the drugs used by teens. Let's take a look at those. Among the most popular, Adderall, Vicodin, and cough medicine. Why are these so popular?
Well, Adderall is a stimulant medication, and there's a common misconception among teens that it's okay to use those as study aids. And so that, of course, perpetuates the culture of abuse that I mentioned. But just as we've discussed that there could be a tie between pain reliever abuse and heroin use, there could also be a tie between stimulant abuse and methamphetamine use, right? So again, we're dealing with the need to educate young people, and all Americans, in fact, about the risks of using substances in general, and prescription medications, of course, need to be used properly at all times. We're not just talking about one particular kind of medications. You need to use care with all of them.
And mindful of that, and we're seeing the video from the National Institute on Drug Abuse there, Michael, about Adderall. Adderall, in the 2 minutes that remain, Adderall seems to be used so widely for attention deficit disorder. The awareness of the drug is there. Perhaps its availability, but not what it can do to harm people. Is the prevalence of Adderall in treating ADHD one of the factors that lead young people to abuse it?
I do think that availability is a big issue, and that's what we've been dealing with on the opioid abuse side, is making sure that the supply of medications available for abuse is actually reduced so that those people who are then abusing can get interventions and be referred to treatment, but also so that people are not willing to try them in the first place. And that's often especially important when you're dealing with young people who do believe that these medications could be used to help them study, for example. So there's the supply side, but then, as I mentioned, there's also the demand side. We need to balance the two, and that, of course, includes therapeutic interventions and referring people to treatment before the problem actually gets to be a true addiction or actually moves on to illicit substance use and addiction.
Michael, 30 seconds left. How can people get in touch with your organization?
Thanks for giving me the opportunity to refer people to CLAAD.org. That's CLAAD.org. And that's where they'll be able to learn some of the statistics that I've been referring to. Also, how to get involved at the state and federal levels in policy. And if you're interested in learning how to protect your family from the harms of prescription drug abuse, you can go to lockyourmeds.org. That's a great website that can be useful for family members, lockyourmeds.org.
Lockyourmeds.org. Michael Barnes of CLAAD, we thank you for your time as you join us from Washington, and we will continue with America's Forum following this Newsmax Now update.